Now, sexually transmitted infections could actually a disease condition that have sent a lot of shock to the whole world. Do you understand? So a lot of people, focus on the treatment, not knowing that there are things that you can prevent. Okay, so let's quickly talk about the prevention, which is more like the preventive medicine aspect of this. Okay, prevent them from coming in, so you even prevent the treatment and all of that. So prevention of sexually transmitted infections. So first of all, if you feel like you can't do without sex, just make sure that your sex is safe. Okay, like use condoms. Okay, routinely, if it is oral sex, using condom or oral sex doesn't really make sense, but probably the person have some oral infections. Do you understand? The vaginal sex, you use condoms. Anal sex, of course, you use condoms. Limit the number of your sexual partners. Know your limits. Even if you are polygamous, right? At least your partners should be people who can be able to count. Okay, don't just have partners that guy you can't even be able to count it. Then avoid anonymous sexual encounters. Don't just meet someone at the bar that same day. You don't even know about that person and you guys already had sex. Do you understand? Then regular testing and screening. So sometimes even if you feel normal, at least every 6 months just go for testing, or 2 months, just know your schedule. So open communication. So if you eventually had the infection, you can openly tell your partner, okay, so that you guys will make out things. Vaccination. So human papilloma virus vaccinations can protect. Hepatitis B vaccinations can also protect you against possible infections from that virus. So don't share needles and syringes. So some of these infections is not really only through sex. Do you understand? Avoid sex under the influence of drugs or alcohol. So medical interventions. Sometimes, if you know that you have a risky behavior, you can just be taking some treatment drugs even before time, so they can help you prevent you from the disease condition, and so on and so forth.